you ever have anyone with ulnar-sided pain, TFCC types of issues, tendonitis, you name it, between the elbow and the wrist, you always have to consider the ECU, right? The extensor carpi ulnaris. And the extensor carpi ulnaris is a little tricky. It starts in the elbow and comes all the way down, and it helps to extend the wrist in an ulnar deviated position. And the job of the ECU is also to give support to the TFCC, right? The tricky thing about this is it's very ulnarly positioned, and as you supinate and pronate, that tendon has to roll, right? So anytime I'm not going to go into testing. I'm going to stay focused and show you some manual techniques that I use myself. So if you have an ECU, just know basically where it's located, the job of the ECU, right, which is wrist extension, ulnar deviation, and also to give support to the TFCC. This patient I'm showing you on, he actually came in for a TFCC issue. We've been able to reduce the pain to almost nothing. He feels a tweak with a certain amount, and this is why I've been able to identify that it's still, the ECU is still giving him some trouble. And you can palpate the muscle here. So I'm going to just use a little bit of cream just because he's a little hairy. So you can palpate right here on the lateral epicondyle, and it kind of sits right alongside that where the ulna is positioned, right? So you can find the lateral epicondyle and you can move down. So it's not the thickness here, but it's kind of underneath and right. Do you see anything? Yeah, right here, right? So it almost sits like a little bit on the side and a little bit under some of the bigger muscles. So one way to find it is with the elbow in a flexed position. And then you could run, and the meat of the muscle is here, and then it becomes tendon. So as we get rid of the pain here, he feels it less here, but still feels it in the tendon. I'm going to show you two ways in which I work the tissue, right? One way I work the tissue is with the shoulder and abduction, and then I'm going to internally rotate, and it's going to expose that muscle a lot better for me. Do you see anything? Right? Just wherever he's a little tight. It also, with the internal rotation, gives a little stress to that area. Right? Right, so he's got a little bit more, a lot of like wrist tenderness, right? So you can work all the way down. You can go, so this is the length of the muscle. You go down, you can go across it, right? You can work, if they can't tolerate the shoulder like that, you can work right here with the elbow in 90 and the rotation of the shoulder in neutral. You can even work, let's go even lower for someone who can't tolerate that. You can bring the arm down and you can put them in a little bit of internal rotation and work this way. All right? This is my second way that I like to do it. So come around on this side. The other thing about the ECU is that it actually does the most work when the forearm is supinated, and that it works better. It works as a stronger wrist extensor in supination. Right? In supination is a stronger wrist extensor. So one way that I get to it is if you follow that side, the lateral side of the ulna, right? So if you go from the epicondyle and you find, basically, you find this is the ulna, this is the olecranon, and you can follow it down. You can follow it right down, right? There's usually in a forearm, when you have it extended, there's a crease. That's where I want to be. You see anything? Right? Oh, I don't know. So usually I put a little bit of cream, right? You put a little bit of cream on your fingers, and will roll across it. Right? I will roll across it. I can roll across it. Once I find it, right? Once I find it, right? I can put the wrist into extension and kind of roll down. So I'm working the length of the muscle, right? Working the length of the muscle, and I'm gonna roll down that crease. Right, so my hand's right here. I'll put my fingers in like this. So I prefer to be with their arm on the outside of me, and I sit on the inside. And then I can roll my finger into that crease and work my way down. Right? And you're working with them in supination. You can also find that pain, and you can roll them into your fingertips. So I'm going to take him from pronation, and I'm going to roll him into supination. ¿Tú sientes? ¿Te gusta? ¿Alivia? Más o menos. Dolor, right? No, es un poco. No dolor fuerte,
No,
pero tú
pero
sientes.
se siente.
Tú sientes, ¿sí? So actually it's a little bit more than ECU, but he doesn't have much pain anymore. He just has pain in a very particular way. And so this is one way that I do it. I'll put him in supination. So once I identify where the pain is, I use position to help push into my hand so I don't have to work so hard. And it's also good to know how to work the same muscle area in different positions because it's going to save your hand. You can work into something for so many minutes, but then you might want to switch. So to give one hand a break, right here, right? And I can feel it, right? This is a wrist extensor. I can shorten it by putting the wrist into extension, and I can shorten it by putting the elbow into extension. And I can just put my finger on it, and I can move him through the motions, and through the movement, it does the kind of like the manual part for me, and I don't have to like use my arm so much. Pero tú sientes, alivia. Alivia. Right? So those are some ways in which you could do apply some of your manual techniques to an irritated ECU, a little bit of lateral tendonitis types of issues. ¿Tú sientes? Me dice, no, yo no tengo nada. Pero, eso, me siento todo. He says, oh no, I'm fine, I don't feel anything. And now, so always when I work wrist extensors, I always take into account the brachioradialis. The brachioradialis starts here and inserts all the way down in that forearm. So sometimes when people are compensating, they will, overuse certain muscles. No, está bien. Oh, it's just showing off his muscles for the video. So it kind of sits right underneath that deltoid. Let's see. Right? So, yeah. So, yeah, you can find it over here. You can find it in this direction over here. Just as long as you're, as long as you know essentially where to find it, then you can work your way through the anatomy and apply some of the manual techniques.